So today's presentation will be by Dr. James Finley. Dr. Finley has been a faculty member here since 2013. He got his undergraduate degrees from Florida A&M in engineering. He went to Northwestern and got his master's and PhD at Northwestern in biomedical engineering. Somewhere along the line, he had a conversion experience and realized that he should be in rehabilitation and physical therapy. So he did a postdoc at Johns Hopkins and then came here when the postdoc finished. He's really a very valuable member of our department, not just in research, but also in teaching and service. So James, the floor is yours.
Well, thank you for the introduction, Jim. And at some point, I can tell you all about my conversion if you don't already know the story. So just want to make sure that so everyone can see the slide clearly. All right. So I don't really have to tell this audience, but mobility impairments are common in several populations with neurological disorders. And in the work that we do in my lab, we're primarily interested in understanding how we can identify factors that impact how we choose to move, and then evaluate how changes in our movement pattern affect what we might refer to as quantitative measures of quality. So we think about things like energy cost and balance control, and how those change when we move in different ways. And ultimately, we like to use some of this more fundamental knowledge to really inform what I like to refer to as the content of therapy. So we try to move our work along this translational pipeline. So as an example, I'll just share a recent study. If you have seen the recent version of neurorehab and neurorepair, this paper was just published there. But we know that people post-stroke often walk with asymmetric gait patterns. And this is despite the fact that they may be able to walk more symmetrically. And so this is just an example. Hopefully you can see the video clearly. But one of the things that we wanted to know is what changes or what impact might improvements in symmetry have on measures of balance. And so to answer this question, we use tools like biofeedback, which allow us to have an individual walk with a more symmetric pattern, so we can give them feedback as they're walking about their individual step lengths. And then we can ask how those changes affect measures of balance. And so one of the interesting things that we found from this study was if you take individuals post-stroke and ask them to walk more symmetrically, what you find for several individuals is that some measures of balance actually become worse. And so this indicated to us that this may, some degree of asymmetry may be, let's say, desirable for individuals to feel as if they're walking in a more stable fashion. And so more recently, we've expanded this work to also look at how people respond to slips and trips on the treadmill so that we can understand features about what we call reactive control. So ultimately, what we like to do is to be able to identify walking patterns or strategies that might be best for a given individual. And so one new tool that we've integrated into our work to do this is modeling and simulation. And so this is work from a postdoc in the lab, Russell Johnson, where we begin to use simulation-based tools that allow us to, for instance, here, simulate someone with hemiparesis, and then ask what are the energy optimal or least effortful walking patterns for that simulated individual. And this makes predictions about how things like asymmetry and energy costs should change as weakness increases. And so ultimately what we'd like to do is to take this type of work and then test the extent to which our model-based predictions can or cannot sort of come to pass when we measure these things in people walking, for instance, in our lab. So finally, as we move toward the most translational end of the work that we're doing, when thinking about tools that we can develop that actually could be deployed in a therapeutic setting, we've largely spent our efforts in the world of virtual reality for this purpose, where we can use computer-based applications that we design, develop, and implement to simulate challenges that people might face in the real world, like obstacles, as you can see here. And we can study things like how people learn motor skills in virtual reality and how those skills might impact their movement when they, for instance, walk over ground off the treadmill. And then most recently, we've done a recent paper that was just published this year's work that we've done in collaboration with a couple of faculty in cinematic arts and computer science, where now we have developed a VR-based application that can be used during overground walking that combines both cognitive challenges, obstacle negotiation, problem solving, and moving across multiple planes and not just in a straight line on a treadmill. And in addition to the interface for the patient, we've also done some work to develop interfaces for the therapist so that the tools that we develop can be modified as to be best utilized based on what is necessary for the patient and therapist pair. So this work has involved several people across the division and as well as outside the division. So I'd like to thank all those involved in the work that I shared today, and also just thank the sources of funding that have and continue to support this work. Thank you.